What a wonderful surprise and such an honor for me to receive this award. You know, you really shouldn't have to get an award for doing something you've really enjoyed for 17 years and whose mission you really believe in. Who wouldn't want to help children in Ventura County with unmet needs for dental and eye care connect with the very generous dentists and doctors in the county who can help them with their problems? Tonight I'd like to accept this award not only for myself, but for my late partner, Rita Marsh, who died 2 years ago. Rita photographed many of you in the audience who were awardees, and she was on the Fainer committee for many, many years. And I want to thank my daughters who live out of state and graciously came to join me tonight, Marianne and Kathy. It means the world to me to have you here. Again, thank you so much.
Recently, in a national meeting where I was speaking, I was introduced as Noelle Radhap. My name is Noelle Kelch, and I'm a registered dental hygienist in alternative practice. My license allows me to have my own private practice and to see clients in a variety of settings, including hospice and on the streets. The mouth is connected to the rest of the body, and when it's not healthy, people are not healthy. According to the Surgeon General's report, the contagious dental disease, decay, is the most common chronic childhood illness, with an estimated 51 million school hours lost to dental-related illnesses each year. When it comes to poor children, who suffer twice as much tooth decay as their more affluent peers and are less likely to have access to care. Can you imagine how different that would be if there was a school hygienist to intervene? You know, it does not stop there. The bacteria present in periodontal disease are one of the most leading and preventable causes of aspiration pneumonia in the elderly. Can you imagine what an impact there would be if all skilled nursing or hospital facilities utilize the services of a dental professional? Doors should not be closed to dental care because you have to go into a facilities. I want to thank my husband Dave and my children Serena, Bryce, and Mariah, who have moved boxes in what used to be a garage, ran errands, and supported me through each dream that I have had. Without them, I would not be standing here, and I share this award with them. I really want you to know what this is all about. I want to thank my clients that do not have homes, that greet me and support me as I bring dental prevention to the streets. Their positive attitudes, their dreams of the future keep my dream going. I want to thank my patients that bring me such joy in the journey. They allow me to cradle them in my laps and make their smiles a little brighter and their health a little better. Access to dental care should be a right, not a privilege.
My name is Sandra Young, and this is my 30th year working for the Ventura County Healthcare Agency. First at the medical center as an ER nurse, and for the last 16 years providing primary care as a family nurse practitioner at Las Islas Medical Group. My proudest career achievement has been to help birth and nurture our county's understanding of and culturally appropriate service to our Mixteco indigenous farm worker population. 1 in 40 Ventura County residents come from this hardworking population, which contributes so greatly to our county's economic success and cultural richness. I am pleased that this award comes from Ventura County Medical Resource Foundation because it was you who funded the very first Mixteco medical interpreter training in our county in 2005. Your vision in providing support to our small grassroots effort was a key step to expanding language access and improving quality medical care for the Mixteco Indigenous community. Today, Ventura County is widely acknowledged to have the best outreach and access program for Mixteco speakers in the country. It has been my privilege to serve the Mixtec community as a founder, a funder, a trainer, a relief volunteer, a medical home provider, and a community booster. I dedicate this award to Mixteco Indígena Community Organizing Project and thank the Ventura County Medical Resource Foundation for your generosity.
Good evening, ladies and gentlemen. My thanks to the Ventura County Medical Resource Foundation for this award, and to Sharon Beck, who nominated me, making this evening possible. I am deeply honored to receive this award. When I was informed I would receive this honor, my mind turned back to the day that I asked Bobby McCaffrey, our chief nurse at CMHS, for a chance to work in the capacity of nursing director of critical care. Bobby took a chance on me that day, and I have always been grateful. Bobby, my mentor, has truly been an inspiration to me. I am so fortunate to work for Community Memorial Health System. Our CEO, Gary Wild, says that we are only here for two reasons: our patients and each other. I am very privileged to be in a position where I can affect patient care and employee morale for the better. I am honored to count my husband as a fellow director and colleague. Dan, I am so very proud of the nurse leader you have become. I sincerely love my job, and I try to make a difference each and every day. We learn from each other, and I've had good teachers. My husband, children, and grandchildren are daily reminders of what is truly important in life, and they never fail to put a smile on my face. I'm committed to a life of learning, and so far life has taught me that with patience and fortitude, we can accomplish great things together. Thank you.
This to me was a godsend, and it made me feel like a human being again, made me feel like a woman.
Sometimes the people that are the strongest need the most help.
My experience here at the Lavender Inn is extremely special. It was like a miracle.
The laughter and the fun with the different ladies, with their different types of cancer. It wasn't, oh, was feeling sorry, but it was a feeling of joy and learning from each other in that experience.
8 years ago, I had a vision to create a wellness retreat for women undergoing treatment for cancer at my bed and breakfast in Ojai. I was fortunate enough to meet Vicki Chandler with VCMRF, and she helped me make it happen in partnership with local hospitals in Ventura County. The program exceeded my expectations in the way it touched and improved the survivorship of these patients' lives. I have held 7 VCMC successful retreats, and with Vicki's contacts and energy, we worked as a team to expand this program to CMH and Dignity Health. Encourage is a 3-day, 2-night respite for these women dealing with financial and often social hardships, all of which is compounded by the physical, mental, and emotional challenges of having cancer. The women are treated to facials, massages, a healthy cooking class, and if they're able, an easy hike. Also full-time on-site group and individual counseling, and a session with a makeup specialist or American Cancer Society Look Good, Feel Better program. The strength of the program is that the women form an immediate bond, and by the next day, they have already shown to be forever connected with the sisterhood. Many of the groups continue to get together regularly as friends, whether to support each other through the tough times, to cheer each other on during chemo and radiation, or just to laugh and share their lives.
I was really excited when Kathy called and invited me to come to the spot, the Lavender Inn, and I was so overwhelmed with the generosity, and I felt compelled to write a letter to her, a note to thank her, and it was just so exciting. But by the time the spot came around, I was very, very sick from the chemo. So I called her and I said I didn't want to take someone else's spot, and she encouraged me to come anyway. And I got a ride up here, and I could hardly walk, and I could hardly even sit. I had to lay a lot, I was so sick. And they took such good care of me here, and it was just so wonderful. And we made such, sorry, I made such good connections with the ladies, and we continue to get together and support each other. And I can't thank anybody enough for the experience I've had. And I just am so grateful that I got to be part of this. And, you know, even just that I was so sick, it gave my husband and my son a few days off too, where they could feel like I was being cared for by somebody else and let them breathe and have a little bit of space. And I just want to thank everybody who's been part of this journey.
Year after year, the word the women use to describe this retreat is transformational. Encourage not only improves their lives, but also the lives of their family.
Good evening. What an honor it is to receive an award such as this, especially when all you do is show up every day, be of service, and hopefully make a difference in the lives of others. As a physician working as a psychiatrist in community mental health, I have the distinct privilege of listening to a patient's most private and intimate thoughts, whether real or imagined, knowing that without engagement, there will be no trust. Without trust, there will be no bond. And without a bond, the likelihood my patient will accept a treatment I recommend or benefit from it is small. We in psychiatry know this. My colleagues know this. And our numerous teams of caring and dedicated case managers, nurses, therapists, psychologists, clinic administrators, and behavioral health managers all know this. Every area of healthcare delivery has its challenges, and one of the greatest we see in mental health care is the struggle our patients have to recover, to maintain their physical and mental well-being, and to lead a life with more joy than hardship, more days clean and sober than not, and more days with shelter than without a home. I am so very proud to work for an agency like ours that is committed to continually improving how we deliver services to our most severely and persistently mentally ill. The number of services offered by Ventura County Behavioral Health and its partners are staggering, and yet we still have gaps in needed programming. There is work to be done, and we owe it to the residents of our county to ensure we can take care of our own. I want to thank the Ventura County Medical Resource Foundation for all that they do for the patients my colleagues and I see, and to the selection committee for recognizing a guy like me who's just trying to do his job. I've had the pleasure of working with many of your former honorees from whom I have learned and hold in high esteem. So I am truly touched to be recognized in this way. Thank you.
I'm very honored to receive this award for Allied Healthcare Professional of the Year and to be in company with other such accomplished honorees here this evening. Thank you to the Ventura County Medical Resource Foundation for this distinguished recognition, and thank you also to my family, my husband Gene Miller and my grown children Matt and Grace, who when they were little labeled me as the mom who works all the time, but always let me know how proud they are of me. Last year alone, we provided over 1,000 contacts for cancer patients and their families, including about 600 individual counseling sessions representing about 300 new patients. Of course, I cannot supply that level of service in a small part-time program like this without the tremendous support of my colleagues at the Cancer Center. Sometimes I'm asked by family and friends if it isn't sad or difficult to work in cancer, but actually I find that it's just the opposite. My colleagues at the Cancer Center are smart and dedicated, they're compassionate and warm-hearted, and it's very motivating to work with them. Our patients are so generous in sharing their lives with me. They're often striving to do the best they can, to empower themselves, to find courage in the face of challenge, and although it's occasionally sad, it's always inspiring. I often joke that I get more hugs per minute at the Cancer Center than any other place I work, and it's true. So feeling a bit guilty about getting an award for doing work that I love, that I find so personally satisfying and uplifting, I humbly and gratefully accept this award. And thank you all very much for coming here tonight to make this such a very special evening.
Rick Chiavaroli was a selfless philanthropist who contributed significant resources, volunteered countless hours, and donated his leadership skills to many worthwhile charitable organizations who served those less fortunate. Because of Rick Chiavaroli's seamlessly endless charitable support, low-income families received comprehensive quality health care, foster kids were ensured a place where they were nurtured, sick babies had life support equipment, underserved women undergoing chemotherapy attended survivorship retreats, nurses were honored, students had booster club and athletic departments. A lifelong Penn State Lion and endowed donor, Rick contributed to less fortunate children, allowing many to receive the education and experience he felt so blessed to be given. Rick was a catalyst who assisted in making positive changes toward improving the quality of life for patients, as well as for patients' families and the communities in which they live. It's been said that the flame that burns twice as bright burns half as long. Though he left the world before his adoring friends, family, and employees were ready, we are here to honor his legacy.
Good evening. I want to thank the Ventura County Medical Resource Foundation for honoring me with the Trailblazer Physician Emeritus Award at this 22nd Annual David Fainer and Leo Tauber Awards Dinner. I'm humbled by this recognition, particularly when I think there are so many of my fellow deserving members of the medical community. When I came to Ventura County in 1970, 45 years ago, I could not have envisioned this evening. It's trite to say, but a lot has happened over the almost half-century. Medicare had just been enacted, and there was a topic of heated discussion similar to the present Affordable Care Act, Obamacare. I wonder what the future will hold 50 years from now. As in the past, Ventura County will play a significant role in its outcome. Ventura has produced giants in the nation's medical community. Charles Hare, president of the California Medical Association. Peter McDermott, president of the American Academy of Anesthesiologists. Michael Lopiana, president of the American College of Radiology. It has been my privilege to have worked with and stood on the shoulders of those who came before me. As I've often said, physicians in Ventura County are the very best in the world. My travels and responsibilities in the U.S. Navy has carried me from the Pentagon, Bureau of Medicine and Surgery, and to the four corners of the world. And I have seen firsthand that we here in Ventura County are second to none in our knowledge and practice of world-class medicine. We are meeting the challenges of digitalizing medicine with the latest electronic medical records and reaching out to all recipients of health care, regardless of ability to pay. Again, I want to thank the Ventura County Medical Resource Foundation for honoring me here tonight.
On behalf of Community Memorial Health Systems, the nurses, social workers, and chaplains that comprise our palliative care team, I accept the Fainer Tauber Award for Specialist of the Year. I thank the Ventura County Medical Resource Foundation for recognizing my work in the field of palliative care, which embodies the principles of quality, empathy, and comprehensive medical care in Ventura County. I am proud to be part of a team working every day to relieve the suffering and distressed patients and their families' experience with illness. We strive each day to restore the dignity and self-esteem lost when illness obscures the life we define by our values, principles, and trusted relationships with our family and our community. As we move our services outside the hospital to our outpatient clinic, I look forward to strengthening the relationship of patients and their doctors by facilitating clear and mutual goals of treatment that improves their quality of life. I again thank you for this honor.
I'm extremely honored as well as surprised to win the David Fainer and Leo Tauber Award this year for Vision Care Specialist. I'd like to thank the Ventura County Medical Resource Foundation for their support of this award, and to thank the selection committee for choosing me, even though I spread my efforts over multiple counties. Dr. Fainer was an extremely exemplary physician who sought to improve medical care in Ventura County, and he had a big impact by heading the family practice residency program here for many years. About 20 years ago, I moved to California after a decade of training at Hopkins, and I also hope to make an impact by building an academic practice, but in my own niche field of retinal diseases. But you never know how successful you might be, and I certainly never expected to win this award. I'd like to thank the 7 retinal surgeons who joined me over the past 20 years and helped me morph my solo practice into California Retina Consultants and Research Foundation, an internationally recognized center for retinal research and care, now with offices in 6 counties. Together we've built on some of my initial research on angiogenesis, which is the growth of abnormal blood vessels in the eye, and pioneered the use of angiogenesis blocking agents to save the vision of countless people with common blinding diseases such as macular degeneration and diabetic retinopathy. I'd like to offer a special thanks to my wife Kelly and my 4 children who've been supportive of my efforts to build this academic practice, even when it cuts into family time. It's been a pleasure and an honor providing care to this community. And again, I'd like to thank you for this kind award. Have a nice evening.
Good evening, and thank you for coming. I would first of all like to thank the Ventura County Medical Resource Foundation and the nominating committee for this award. The Primary Care Award is given to one provider each year, but just like it takes a village to raise a child, it takes nurses, medical assistants, receptionists, and administrators to make an office run smoothly. So I would also like to take this opportunity to thank all those I have worked with these many years. Therefore, starting in alphabetical order, I want to thank, don't worry, I won't bore you with all that. I would like, however, to thank the people at Assisted Hospice who I'm thinking might have stuffed the ballot box in order to help get me nominated. I would like to thank my dear wife Lisa and my 3 children, Anders, Anna, and Ella, for all of their love and support in tolerating my somewhat unconventional humor. As I think back over more than 20 years in primary care, it is the patient interactions and stories of their lives that are the most memorable to me. So when things are feeling frenetic, when the electronic medical record feels like more of a hindrance than any kind of a benefit, I try to remind myself of what a privilege it is to be in this medical profession, to have patients trust in you, to have them tell you things they won't tell anyone else. And sometimes I try to take those 2 extra minutes to hear, as Paul Harvey used to say, the rest of the story. So again, I thank you. I encourage all of you every once in a while to find those couple of extra minutes in the day that you don't think you have, and just sit back and listen. You might be rewarded with something very memorable.